My name is Joan Marin. I am the president of the Board of Directors of Nurses Educational Funds, and I'd like to welcome all of you to this year's celebration of our 2024, 2025, 2026 NEF scholars. And many of our scholars are with us this evening, as you can see from your screen or screens. In addition, we have a number of members of our NEF Board of Directors, our advisory board, and some emeritus members with us also. We have our NEF scholarship benefactors and facilitators. A couple of them are with us, and we have a number of deans and directors. For those of you who may not know about the organization, we have been around for quite a long time, actually more than 100 years. And we, for all of that time, have had the same purpose and a single mission, which is to promote leadership and health equity through scholarship support for professional nurses who are seeking master's and doctoral degrees in nursing education, practice, service, and research. That is our single purpose. That's all we do. And we do it, I think, quite well. And we're very proud of what we do and proud of the recipients of our scholarship support as well. We hope to be the national leader in providing scholarships to nurses that benefit our profession of nursing, healthcare generally, and the global community. And a lot of our scholars have done very significant work in the global health community. I'd like to spend just a couple of minutes introducing our NEF Board of Directors. Not all of them could be with us tonight, but many of them are here, and I'd like you to know who they are. So if you're on the screen, give us a wave as I call your name. Again, if you're not here, we want those who are attending to know who you are. Our Vice President is Maddie Mezzi. Secretary is Roseanne Rasso.
Hi.
Our Treasurer is Ann Vanderberg. Board members include Allison Adams-Wazorek, Natalia Saneas, Michelle Crespo Fierro, Harriet Feldman, Nina Harvey, Betsy McDowell, Anna Maria Muñana. I know I see Anna Marie there. Kelly Riley, Nancy Rockline, Phil Ryan, Cynthia Skulko, and
Hi
Maria
there.
Vizina. We have a couple of members of our advisory board. At least one I know is here, and that's Joan Arnold. And Edwige Thomas is also a member of our advisory board. These are both longstanding board members whose tenure on the board has either expired or will very shortly expire. They go off for a period of about a year, and then if they so choose, come back on, but continue to work with us and to support the work of the organization throughout their advisory board membership. We also have, I know, at least one NEF board emeritus member who signaled that she would be joining us, Susan Bauer-Ferris. Other emeritus members include Kathleen Dershel, Barbara Hazard, Margaret McClure, Henry Spencer, Neville Strumpf, Madeline Sujimoto, Gerard Stubbe, who's with us in the background. Oh, there you are, Gerard, who's our IT manager, Dominic Testa, and Rita Reese-Wazorek. Our executive director is Geraldine Weiss, and she's here with us on the screen as well. And I mentioned Gerard Stubbe. We have several of the NEF scholarship benefactors or members of our board, for example, who facilitated the acquisition of those scholarships. The Allison Adams-Wazorek Scholarship for Maternal, Infant, and Pediatric Nursing, and Allison Adams-Wazorek, our board member, facilitated that. The AJN Thelma Shore Scholarship, the editor-in-chief of AJN, Carl Curtin, could not be with us this evening, but that is in honor of the late Thelma Shore, who just passed away at the end of last year and was a many year member of the NEF board. The Charles Hamlin Scholarship, Dr. Charles Hamlin was not able to attend this evening, but that scholarship was facilitated by Cynthia Skulko. The Columbia University Presbyterian Hospital School of Nursing Alumni Association, the J. Margaret Ada Much Scholarship, and a second scholarship, the Columbia University Presbyterian Hospital School of Nursing Alumni Association Scholarship that honors Penny Hund West. And that was awarded for the first time this year. Both of these scholarships were facilitated by our NEF board member, Joan Arnold. The Cynthia Davis Skulko Scholarship, facilitated again by our board member Cynthia Skulko, who's attending. The Estelle Massey Osborne Scholarship, which is sponsored by the Freedmen's Hospital Nurses Alumni Clubs, Inc. The treasurer, Marcia Jackson Hoopers, may or may not be with us, I'm not sure. The Francine Bono Neary Scholarship, which is focused on the prevention of human trafficking, and Francine is attending this evening. The next three scholarships were created by Mary Insall, who is not able to attend, but these scholarships were facilitated also by our board member, Cynthia Skulko. And they include the Mary Insall Scholarship, the Georgette Villon Scholarship, and the Joanne V. Pontier Scholarship. The Henry B. Spencer Scholarship. Henry is unable to attend, but he also is a longstanding or was a longstanding member of our board of directors and is a board member emeritus now. The Joan L. Conroy Scholarship, which is established by Regina Conroy Keller and the Conroy family. Regina cannot attend, but sends her regrets to the 2025 Joan Conroy Scholar, Jody Bondurant. And Regina is also a former member of our board. The Laura D. Smith National Student Nurses Association, Kenya Williams, Executive Director of the National Student Nurses Association, could not attend tonight, but they have sponsored a scholarship. The Madeline A. Nagel Scholarship for Mental Health Nursing, I believe Madeline is attending. The Margaret L. McClure Scholarship, Maggie is not able to attend tonight, but again has sponsored a scholarship. The Maddie Mezzi Scholarship, facilitated by Susan Bauer Ferris. Dr. Mezzi is here, but must leave for another engagement early. So the person who has been awarded that scholarship, we will give her and one other first preference to sharing information about themselves. The Maxine E. Elcom Scholarship, established by Diane Mancino, who cannot attend this evening. Miriam Powell Scholarship. Miriam Powell will not be attending either. The Mount Sinai Hospital School of Nursing New York Alumni Association. The Edith G. Ryan and Joan Herman Builder Scholarship was awarded this year for the first time. The facilitator of the scholarship is the president of the Alumni Association, Phyllis Hansel. And Philip D. Rasso Scholarship, facilitated by NEF Secretary Roseanne Rasso and her family. Roseanne is attending, but will also be leaving early as well to another engagement.
Hi again, everybody.
Rita Reese Wazorek Scholarship for Maternal, Infant, and Pediatric Nursing. Rita is attending. The Susan Bauer Ferris Scholarship for Nursing Leadership in Attaining or in Seeking to Attain Magnet Status. Susan is attending. And the Terry Fulmer Scholarship for Long-Term Care Nursing, facilitated by Maddie Mezzi and Dr. Terry Fulmer may or may not be here. It depends on her schedule this evening. Next, I'd like to introduce the deans and directors and nursing program representatives who are attending, who are the ones who support and encourage our scholars to apply and to participate in this process. We have L. Todd Hammond, DNP. He's the program director of nurse and anesthesiology, and Dr. Cassandra Massey, nurse and anesthesia assistant program director from the Arkansas State University. They have one scholar. Dr. Corinne Y. Juergens, professor, Boston College, William Connell School of Nursing. There are two scholars from Boston College. Dr. Mary Hickey, Vice Dean of Education, Columbia University School of Nursing, 3 scholars. Also from Columbia School of Nursing, we have Ellen Fahey, who's the program director of the FNP DNP. and Letitia Hansen, Program Director, Psych Mental Health DNP, and their specific students have received scholarships. Dean Roberta Waite, Georgetown University School of Nursing, 2 scholars. Dr. Melody Cash, Nursing Department Chair, Goshen College, Easton Mennonite University, the DNP Consortium, 1 scholar. Dr. Anne Marie Morrow, Hunter Bellevue School of Nursing, she's the dean. And we have additional representatives from Hunter Bellevue. They're out here at force. There are 3 scholars from Hunter Bellevue. And in addition to Dr. Anne Marie Morrow, we have Dr. Maya N. Clark Kutaya, who's Associate Dean for the Nurse Practitioner Programs, Dr. Melissa O'Connor, who's the Associate Dean for Research, Dr. Elizabeth Capizzuti, PhD Program Director, and Dr. Barbara Postmontier, Chair, Psychiatric Mental Health. So those are our representatives from Hunter Bellevue School of Nursing. Dean Lorna Finnegan, Loyola University in Chicago, 1 scholar. Janet Carpenter, Interim Dean of Indiana University School of Nursing, 1 scholar. Robert Atkins, Executive Vice Dean, Johns Hopkins University School of Nursing, 1 scholar. Kelly Walker, Senior Associate Dean for Academic Affairs, New York University, Rory Myers College of Nursing, 2 scholars. Jacqueline Jones, Professor and Assistant Dean of the PhD Program, University of Colorado College of Nursing, Anschutz, 3 scholars. Dean Hillary Thompson, University of Washington School of Nursing, 1 scholar. Maria J. DeJong, Dean, University of Utah College of Nursing. And in addition, she's joined by Shelley Kern, DNP Program Manager, and Heather Clarkson, Student Scholarships and Funding Administrator. Deborah Shearer, Director, Postmaster's Doctor of Nursing Practice, DNP, from the Villanova University, M. Louise Fitzpatrick College of Nursing, 1 scholar. Dr. Christina Aaron, Assistant Dean of Enrollment and Student Services at Wayne State University College of Nursing. Are there any other deans or directors or representatives of colleges that are present in the Zoom meeting that I have overlooked?
My name is Carrie Radmal. I'm from the University of Utah College of Nursing, supporting Rachel Alexander.
Wonderful. Thank you. Thank you. Anyone else?
Good evening, everybody. I'm Michael Horst from Eastern Mennonite University. I'm Dean of Health, Behavioral, and Natural Sciences, here supporting Margaret Burr.
Thank you. There are other nursing programs represented this year among our scholars as well. The Frontier Nursing University had 1 scholar, Marquette University, 1 scholar, Northern Arizona University, 1 scholar, Morehead State University, 1 scholar, the University of Arizona College of Nursing, 1 scholar, the University of Northern Colorado, 1 scholar, the University of Pennsylvania, 3 scholars, University of Wilmington, 1 scholar, Walden University School of Nursing, 1 scholar, Wilkes University, Passan School of Nursing, 1 scholar, and William Patterson University, 1 scholar. This year, we have 37 scholars, 37 up-and-coming nursing leaders who are being supported in their master's and or doctoral programs. So we are really pleased to recognize you this evening and to celebrate your work. So if there are no other deans or directors present that I missed, we will move on and turn the program over to the founder of our NEF Circle of Scholars and who is now an NEF board member, Dr. Nancy Rockline, and she will lead the NEF Scholar Pinning and present this year's scholars to the large group. Nancy, take it away.
Thank you, Joan. Good evening, everybody. It's a real pleasure to be a part of this event tonight and to introduce the scholars and hear about all the important work that they do. My relationship with NEF goes back to when I was in my master's program at NYU and just saw the name of the scholarship on a long list and had no idea about all the good work that they do. I was awarded that scholarship. I was awarded a scholarship in my doctoral program. I was asked to participate in an interview on a particular anniversary, which was my pleasure to do. And then, as Joan mentioned, as a way to connect the scholars to each other, worked on developing the Circle of Scholars and also that pin that we're going to have the ceremony for in a minute. And I think it's a beautiful pin. And so I hope that you'll take a moment now, all of the scholars, to have someone or yourself place your NEF pin on your lapel. And I'll give you a minute to do that. So congratulations to you all, and I hope you'll wear that pin as proudly as I do. So now I'm going to introduce the scholars. I'm just going to remind you that while we're thrilled that we have such a large group, I will ask you to be mindful of the time so that we get to everybody and that you keep your remarks to 2 minutes. As has been mentioned, we're going to introduce a few scholars out of alphabetical order, and then I will, after those two, return to the alphabetical order. So the first scholar I'd like to present tonight is Precious, known as Gem, Precious Gem Ine, and she will now present her work.
Good evening, everyone. Thank you for having me here. So my name is Precious Gem Inay, so you can call me Gem. I am from New Jersey. I am grateful and honored to be the recipient of the Philip D. Raso Scholarship. So a little bit about me. I began my nursing journey in the Philippines, where I graduated with my BSN and worked as a nurse for 4 years, moved to the US in 2004, went back for my master's at William Patterson in 2014. I love being an ED nurse, so I stayed at bedside. I was a clinical nurse for over 20 years. And in December 2021, after witnessing COVID firsthand, as an ER nurse, I decided to be the ED educator. So I am currently serving as a nursing professional development practitioner at Englewood Hospital for almost 4 years now, where I promote excellence through evidence-based education and collaboration. I decided to go back and start my DNP in 2023 because I realized that as an NPD, I needed to learn more, especially if I wanted to make an impact and influence, not just in nursing, but also in the community. So beyond the hospital walls, I would like to share with you that I am also proud to serve as a president of the Philippine Nurses Association of Bergen Pasig Subchapter, and our subchapter has been awarded the Daisy Team Award for Health Equity for 2 times. So with those awards, I realized I need to learn more about like I said, making an impact so I can have more influence and to be a better nurse leader capable of nurturing not just the next generation of nurses, but also nurses, and provide expertise that I will be needing in addressing like social issues in healthcare. And as an ER nurse and ER educator, I have witnessed a lot of social issues. So receiving the Nurses Educational Fund Scholarship is a profound honor for me. It validates my commitment to lifelong learning and fuels my mission to empower nurses, elevate patient care, and lead with a purpose. Thank you very much again to Dr. Roseanne Raso for the opportunity. And once again, I appreciate and very grateful for receiving the scholarship. Thank you.
Thank you, Gem. Our next scholar will be Natalie Radino.
Hi, good evening. I'm so happy to be here. When I think about what drew me to nursing, I always come back to the people, the stories, the resilience, and the privilege of being trusted in someone's most vulnerable moments. And that same sense of purpose is what brings me here today. As a proud second-year DNP student and the Nurses Educational Fund Scholar in Dr. Matthew Mezzi's name. Dr. Mezzi's incredible legacy in gerontological nursing and her lifelong commitment to advancing the care of older adults is a mission that truly resonates with my path. My nursing journey began at Farmingdale State College, and since then I've completed both my bachelor's and master's degrees at Stony Brook University. And I've always had a focus in adult and gerontological health, and today I serve as an adult gerontology nurse practitioner at NYU Langone Hospital, Suffolk, where I care for patients with complex conditions, including neurological and autoimmune disorders. And being a part of a team that continuously expands access to advanced infusion therapies has been both challenging and incredibly rewarding. So for my current DNP quality improvement project, I'm focusing on improving transitional care for patients living with heart failure, particularly those with preserved ejection fraction. This population is growing rapidly, so enhancing care coordination and self-management and continuity between hospital and home is essential to reducing readmissions and improving their quality of life. Throughout my career, I've been guided by empathy, something that's deepened after a personal health experience that reminded me just how powerful compassionate care truly is. So outside of my work, my roles as wife and mother continue to ground me in my career and strengthen my dedication to holistic and patient-centered nursing. And looking ahead, I plan to continue leading quality initiatives and mentoring future nurses and contributing to policies that elevate the standard of care for older adults. And I'm so grateful to NEF for this recognition and for supporting my commitment to lifelong learning and compassion to leadership. Thank you.
Thank you, Natalie. And now I'd like to introduce our next scholar, Ayo Adebiyi. I probably mispronounced that. Sorry, Ayo.
That is fine. Yeah, it's Ayo. You pronounced it correctly. Hello, everyone. My full name is Ayomida Mokbe, and I go by Ayo Adebiyi. I'm a dually board certified family nurse practitioner and occupational health nurse specialist. I work here at the University of California in Merced. I'm honored to be the recipient of the 2025 Elizabeth Carnegie Scholarship from the Nurse Educational Funds. I'm a Doctor of Nursing Practice student at Johns Hopkins University, concentrating in executive leadership and also completing a postmaster's certificate in nursing education. My academic and clinical focus is on creating safer workplaces. My doctoral program actually evaluates the program to prevent musculoskeletal injuries among workers in high physically demanding jobs. My career path is dedicated to bridging clinical practice, health policy, and education. And I plan to use my leadership role in occupational health in pioneering, systemic changes in worker safety standards. And as a future nurse educator, to train the next generation of nurses on this vital principle. This scholarship, named after a pioneer who broke down racial barriers, owed deep meanings to me. It's really not just a financial support, it's really a profound affirmation. He affirms my commitment to advocating for underrepresented communities, both in the workplace and also in global health. And this award really kind of strengthened my resolve to be a leader that expands reachable, equitable, and compassionate care for everyone. So thank you so much for this opportunity.
Thank you, Ayo. Our next scholar is Rachel Alexander.
Hi, I'm honored to be here tonight to wear this pin. Yes, I'm Rachel Alexander from the University of Utah. I'm currently a dual PhD and DNP student there, and I'm honored to be the recipient of the Terry Fulmer Scholarship. And she committed her life to gerontological nursing, and my DNP specialty is in adult gerontology primary care, where I hope to stay as an oncology nurse. I have 20 years of background working as a bedside nurse in oncology, and that's where my passion lies. And when I was looking into graduate school, I just couldn't decide between the DNP or PhD because being a cancer nurse, I just am fascinated by cancer research and wanted to be able to do research more fully with the PhD. So I chose the dual program. And so I finished my third year and just defended my dissertation proposal, which is going to be a mixed method study using the Utah Population Database to look at the influences of family caregivers on end-of-life care decision-making for those patients with advanced cancer. So that's my trajectory academically. And then for my career, I want to become a clinical scientist and hope to stay where I am at the Huntsman Cancer Hospital in palliative care and help develop interventions for earlier palliative care referrals. So receiving this scholarship at this time in my life, not only eases my financial burden of graduate education, helping me balance. I have 5 young children still at home, but it does also affirm to me the importance of my mission to improve early palliative care utilization and support family caregivers of my advanced cancer patients. And I have a ultimate goal of influencing policy and care delivery in a meaningful way for cancer patients. And I'm truly honored to carry forward the values and goals that the Terry Fulmer Scholarship represents. So thank you.
Thank you, Rachel, from another oncology nurse. Our next award recipient is Jody Bondoran.
Hi, everyone. My name is Jody Bondurant, and I am honored to be the recipient of the inaugural Joan L. Conroy Scholarship. I'm currently attending the University of Colorado Anschutz Medical Campus and pursuing a Doctor of Philosophy degree within the graduate nursing program. My current academic focus is on healthcare systems and improving emergency department patient health outcomes. I have lots of plans for my future career, including developing collaborative and sustainable outcomes-focused research that would fulfill the unmet healthcare needs within various vulnerable and underserved communities. This could be through obtaining grants or mentorship opportunities and continuing education, and I would like to go on and continue my educational work with nursing students. What the NEF scholarship means to me is peace of mind knowing that I am more financially secure when paying for school. I'll also be able to spend less time picking up extra shifts at work, more time studying, and more time with my family. Thank you so much to the family that is honoring Joan Conroy through this scholarship and to NEF for believing in me.
Let me introduce our next scholar, Jennifer Bottoms-Robb.
Hello, everyone. My name is Jennifer Bottoms, and I'm so honored to be a second-year NEF scholar and recipient of the Nurses Educational Fund Scholarship.
Good.
I am currently enrolled in the Hunter Bellevue School of Nursing at Hunter College, entering my final year of study for my master's degree to become a psychiatric mental health nurse practitioner. I came to nursing as a second career and have worked as a neonatal ICU nurse for the past 20 years, spending the majority of that time at Northwell Health's Cohen Children's Medical Center. And while I love caring for babies and their families, since getting my bachelor's in psychology years ago, I've always been passionate about mental health. And throughout my work, I have strived to connect with people, and their personal stories have always resonated with me. And I'm excited to redirect my career towards the psychiatry specialty. I look forward to exploring how to best aid my community in a few specific areas of interest. My primary goal is to provide a safe and culturally competent space for Black families who have been underserved for many years and have grappled with a lot of barriers to optimal mental health, including intergenerational trauma, distrust of healthcare professionals, lack of resources, and stigma. And I want to help bridge the gap that exists due to the lack of mental health providers of color. Secondly, I would like to assist young people in tackling their mental health issues early on with the hope of preventing more severe mental illness from developing in the future. And lastly, as a result of the higher rate of infant mortality among Black Americans, I'm also interested in helping NICU parents work through the unique mental health challenges that arise due to an extended hospital stay with a critically ill child. And my long career as a NICU nurse has made it clear that this is an area that requires more focus. And I look forward to exploring all of these areas more in my clinical experiences this fall and the spring semester in inpatient psychiatry and the perinatal mental health clinic where I'm currently working, and see how I can most effectively make a difference. I'm overwhelmed with gratitude for the generosity of Nurses Educational Fund, and I sincerely appreciate NEF's dedication to helping numerous nurses achieve their educational goals year after year.
Thank you, Jennifer. Our next scholar is Rosaline Buyeka.
Well, hello, everyone. My name is Rosaline Buyeka, and tonight I'm honored to be the recipient of the Judith G. Whittaker Scholarship. My nursing journey started way back in Kenya, where I first earned my Bachelor of Science in Nursing degree. Growing up in Kenya, I witnessed then how health disparities affected outcomes among the population. Later on, when I moved to the US, I continued to see disparities being displayed in healthcare. At that point, I decided to earn a Master of Science in Clinical Systems Leadership at the University of Arizona with an aim of influencing health equity from a systems level. Currently, I'm enrolled at the University of Washington here in Seattle, and I'm pursuing a Doctor of Nursing Practice degree specializing in population health and systems leadership. My academic focus is on systems leadership, workforce development, and culturally responsive care. As part of my DNP work currently, I am collaborating with the Washington Board of Nursing to examine nurse administrator turnover here in Washington and inform statewide workforce development initiatives to enhance the retention of nurse leaders. As we all know, nursing leadership is where it all begins, and that's very critical for us to promote. As a nurse leader right now, committed to promoting health equity and working with the underserved populations. I currently work at the International Community Health Center, a federally qualified health center here in Seattle as the Director of Clinical Services, overseeing multidisciplinary teams in providing patient care. With this degree, I envision leveraging my DNP training to shape policy, strengthen leadership capacity, and design sustainable systems that will ensure equitable access to high-quality care. This scholarship really means a lot to me. It's more than just financial support. It's a powerful affirmation of my commitment to transforming healthcare systems, promoting health equity, and uplifting the underserved communities. It enables me to continue developing the leadership capacity that is necessary to shape policy and design sustainable models of care. Thank you all very much for investing in the future of nursing leadership. I appreciate it.
Thank you, Rosaline. Our next scholar is Lizette Carmona.
Hi, good evening, everyone. My name is Lizette Carmona. I am deeply honored to receive the Charles Hamlin Scholarship. I am a second-year doctoral student in the Adult Gerontology Acute Care Nurse Practitioner Program at Columbia University School of Nursing, and I am also a registered nurse at Hackensack University Medical Center in the cardiothoracic ICU. My academic focus is on enhancing healthcare access and outcomes for patients with chronic conditions like diabetes, hypertension, and heart failure. This drive comes from my childhood, watching my mother struggle with a serious illness while facing barriers such as the lack of insurance and language difficulties. These challenges inspired my dedication to patient education and advocacy. As nurses, we are not only caregivers, but we are also advocates, educators, and policy shapers. In my career, I do plan to create outreach programs to proactively meet patient needs, reduce hospital readmissions, and also improve community healthcare access. I also aim to shape healthcare policy in the future to address systemic gaps and support nurses in exceptional care while preventing burnout. The Charles Hamlin Scholarship is profoundly meaningful as it reduces the financial burdens as I pursue my degree and empowers my mission to promote equitable healthcare and elevate patient care through advocacy and dedication. I'd like to thank everyone, Mrs. Wise and the NEF team, for their dedication to empowering students and believing in the transformative power of nursing leadership. And thank you again for this incredible honor, and congratulations to all my fellow scholars.
Thank you, Lizette. Our next scholar wasn't able to attend tonight, but has sent a video. This is Meredith Casella Jean Baptiste.
Hello, everyone. My name is Meredith Casella Jean Baptiste, and I'm the honored recipient of the Columbia University Presbyterian Hospital School of Nursing Alumni Association Penny Hund West Scholarship. I'm a PhD student at the University of Arizona College of Nursing, and my area of interest is in respectful maternity care, where I hope to pursue my professional goal of integrating research with my dedication to working in the global maternal health field. I am so grateful to be the recipient of this Nurses Educational Fund Award. It will allow me to continue my studies and apply the knowledge and experiences I have had the privilege of obtaining in order to uplift other nurses, especially in the global health arena. Sorry I can't be with you all today. Congratulations, everyone, on your scholarships.
The next scholar has also sent us a video, Joelle Kraft.
I'm Joelle Kraft. I was selected as the recipient of the Mount Sinai Hospital School of Nursing, New York Alumni Association, Edith G. Ryan and Joan Herman Builder Scholarship. It is an incredible honor to be recognized in this way, and I am sincerely thankful to receive this support. I am a graduate student at Morehead State University in the Masters of Nursing Family Nurse Practitioner program, which is a primary care program. And after graduation, I am committed to serving the patients within our community. This scholarship lightens the financial burden of my studies, inspires me to continue to strive for excellence, and enables me to continue to care for my young family. I just wanted to thank you for this opportunity.
Terrific. Our next scholar is Alyssa Crianti.
Hi, everyone. My name is Alyssa. I am honored to be the recipient of the Evelyn J. Barclay Scholarship. I am a PhD candidate at the Boston College Cannell School of Nursing, where my research focuses largely on loneliness of older adults and specifically their older adult informal caregivers. This award provides me with support to continue my dissertation work and to share my findings with others. In just a few weeks, I will have the privilege of presenting some of this work at the upcoming Gerontological Society of America conference in Boston. Alongside my research, I do remain committed to continued patient care at Massachusetts General Hospital in Boston. Here is where I teach clinical groups in adult health and public health, and take part in initiatives to support novice nurses in their transition to practice. So looking ahead, I aspire to build a career in academia that bridges, this research, practice, and education together. I'm really passionate about bringing forward the unique needs of our older adult patients. I'm really passionate about palliative care and ways that we can support patients and their care partners as we continue with our aging demographics. So with that, I am deeply grateful and to the NEF for this opportunity. I'm really looking forward to what's ahead, and I appreciate this opportunity.
Thank you, Alyssa. Let me introduce our next scholar, Sergine Delma.
Hi, everyone. My name is Sergine Delma, and I'm deeply honored to be the 2025-2026 recipient of the Cupsona Margaret Ada Much Scholarship. My nursing journey began as a palliative oncology nurse at Mass General Brigham's, part of the first cohort of new grads hired into the unit. And rather than feeling intimidated, I leaned into the privilege of caring for patients at the end of their lives and supporting their families. It was really a humbling and transformative experience. And I am now pursuing my DNP in family nurse practice with a subspecialty in oncology at Columbia University School of Nursing. I worked as a quality manager, which deepened my commitment to improving care systems and advancing health equity, and will soon begin my new role as an oncology nurse practitioner. My academic focus centers on primary care and oncology care with a growing passion for exploring how artificial intelligence can make healthcare more equitable and effective. My research examines how AI can reduce bias in nursing documentation and enhance early prediction and management of chronic diseases such as type 2 diabetes. I believe that nurses must be at the table from the conception to the implementation of new technologies to ensure that it truly benefits every patient equitably. Looking ahead, I hope to build a career at the intersection of clinical practice, technology, policy, and health system leadership. Through translational research and advocacy, I hope to bridge the gap between evidence and practice while also amplifying the voices of nurses in policy decisions and ensuring that we are not only providers of care, but also architects of the system that shape it. The NEF scholarship means so much more than financial support. It represents trust, hope, and shared belief in the future of nursing. It reminds me that the long nights of study, the research, the advocacy, and the service all matter. And it connects me to a powerful legacy of nurses who paved the way for others to dream bigger, lead boldly, and transform care for generations to come. So thank you for believing in that vision and in me.
Thank you, Surjean. Our next scholar is Amani Elhaj.
Hello, my name is Amani Elhaj. I'm from Wayne State University. Um, I am a second year. Well, yeah, I'm gonna go into my third year. I do graduate in May. Oh my gosh, time is flying. I am full time. I did graduate nursing school in May of 2023, and Dr. Aaron, who's here representing me, pushed me to go right into DNP. So I did not get a break, but it's been a great experience, and I've always wanted to do it. Um, well, let me first, I'd like to express my heartfelt gratitude for being selected as the recipient of the 2025 Margaret McClure Scholarship. This honor means more than words can convey, and I am deeply humbled. Um, so I've been a nurse for 2 years now. I'm in my third year. I've throughout my nursing career, I have demonstrated leadership in addressing healthcare challenges and improving patient outcomes. During clinical experiences, in undergrad, I was able to implement like a chest tube management checklist on my unit that I worked on. So that was nice. We were managing a lot of chest tubes, and it was a way of trying to improve the patient quality. I was noticing with, a lot of float nurses or like people getting pulled and not knowing how to manage it. So it was a nice checklist that we were able to use. Currently, I have implemented for my DMP project. I'm sorry, addressing the growing concern of the e-cigarette use among pre-adolescents. I evaluated the Catch My Breath program, effectiveness in preventing the e-cigarette use among 7th and 8th graders at a middle school here in Dearborn. Looking at the results, I've seen so much improvement, and I feel very satisfied. Um, Again, so yeah, thank you. And I am committed to honoring this investment by excelling in my studies and maintaining the highest standards of patient care and giving back to the nursing profession and my community in this same spirit of leadership and service that has defined Margaret McClure's remarkable career. Thank you.
Thank you, Amani. What wonderful exuberance for nursing. The next scholar is Ashley Fisher.
Hi, everyone. My name is Ashley Fisher, and I am honored to be the recipient of the Mary V. Insall Scholarship through Nursing Education Fund. I am at Walden University currently, and I am getting my family nurse practitioner with my Master of Science in Nursing. And I'm just focusing on the family-centered care. I got my LPN and my Associate RN and Bachelor's from Colorado Mesa University and had my CNA before that. And I have been a wound ostomy and continence nurse at our local hospital for 10.5 years now, working with that population, which I very much enjoy. Our community needs to bridge the gap in wound and ostomy care. And I also started a support group through the United Ostomy Association of America for our community, where we have a lot of ostomy patients. That's been extremely rewarding over the years. And my goal going forward is to become a nurse practitioner in our town for the wound and ostomy population and stay at our local hospital. And I'm very grateful that you guys gave me this scholarship. Financially, it has allowed me to focus on my goals and my schooling. And it is an encouragement because it reminds me that others believe in the passion of nursing. And I'm truly grateful for the support from this scholarship. And I am excited for the opportunity to grow and serve my community through nursing. Thank you, everybody, and congratulations.
Thank you, Ashley. And our next scholar then would be Margaret Furr.
Hello, everybody. My name is Margaret Furr, and I'm honored to be the recipient of the 2025 NEF Eleanor C. Lambertson Scholarship. I want to extend my heartfelt thanks to the NEF board and to the donors for their generosity in providing the scholarship. And congratulations to all the fellow scholars honored tonight. I am truly touched by your stories. I'm in my final year of my Doctor of Nursing Practice Studies at the Goshen College Eastern Mennonite University DNP Consortium. I am so proud to have been a registered nurse in Virginia for over 23 years. I've held many varied positions over the year in a small community hospital, eventually landing in education where I served as a nursing professional generalist and then specialist a variety of units, including pediatrics, behavioral health, and medical surgical. This was a position that led me to go back to school after 20 years, and I obtained my MS in education from Walden University, mostly because I wanted to teach better. In addition to providing post-degree education in a hospital, I've also worked as an adjunct faculty for EMU. When I left my MSN program, I knew that there was still so much more that I wanted to learn, so much more that I wanted to be able to do in my organization to improve the health of our patients and our communities. And I started a DNP program later that year to the chagrin of my teenagers. My DNP project is on improving the experience of care for staff who have experienced workplace violence by working on organizational support, unit leadership training, and creating a peer support group to provide care. My current role is as a Magnet Program Director for my hospital, overseeing professional practice in education and Magnet. So this project bridges several areas that are important to me: the care that we provide to staff, education, and my training in behavioral health nursing. Everything always comes back together. I am so grateful for not just the financial support of the scholarship, which has allowed me to continue pursuing my dreams, but really for the affirmation of what I've been able to achieve over these years and the affirmation of my goals and my dreams for the future as we seek to improve healthcare in these changing climates. I'm the mom of a high school senior and a college sophomore, so this investment in my future has made it easier for me to pursue my professional dreams while continuing to care for my family. Thank you so much.
Thank you, Margaret. Our next scholar, I'd like to introduce Jennifer Gill.
My name is Jennifer Gill, and I'm truly honored to be this year's recipient of the Cynthia T. Skolkel Scholarship. I want to sincerely thank Dr. Skolkel and the Nurses Education Fund for this recognition, and for your continued commitment to advancing nursing education and leadership. As a first-generation college graduate and nurse, this award holds both personal and professional meaning. It not only eases the financial challenges of doctoral study, but it also reaffirms the importance of equity and access in nursing education, values that guide my work every day. Currently, I am a fourth-year PhD candidate at the University of Pennsylvania School of Nursing, where I serve as a presidential and Fontaine Fellow. My dissertation examines how social determinants of health, such as housing, food insecurity, and access to care, affect emergency department use after a hospitalization, particularly looking at the Medicaid and dually insured population. Using a mixed methods approach, I combine predictive modeling with patient narratives to explore how care transitions can be more equitable and responsive to the realities patients face after discharge. This work is deeply inspired by my time as a frontline nurse in emergency and critical care, where I witnessed how social and structural inequities shape health long before a patient arrives at the hospital. Receiving the scholarship is more than an honor. It's a reminder of how our shared mission to strengthening nursing, advancing scholarship, and mentoring the next generation of nurse leaders can impact the health of our nation. Thank you again, Dr. Skolkel and the Nurses Education Fund for your generosity, your vision, and your belief in nurses like me. I'm deeply grateful and inspired to carry forward the values this award represents. Thank you so much.
Our next scholar is Alexandra Gordon.
Hello, everybody. My name is Allie Gordon. I'm so excited to be here tonight. I am the proud recipient of the NEF Georgette Villon Scholarship for advancing nursing education. Apologize, my daughter has been ignoring me completely until this. I'm currently a PhD candidate at the University of Colorado College of Nursing, and I'm focusing on caring science. My research is focused on humanizing nursing work and supporting nurse flourishing. I have been a nurse for the last 20 years, or almost 20 years at this point, and most of my career was situated in the emergency department, and in 2015, I formally moved into an educator role. In addition to working as a nurse, I have always been a writer and an educator and love to bring my passion for those into all of the work that I do. And my journey in my doctoral studies is very personal. And my first child was born in 2017, and upon his birth, we learned he had an unexpected terminal diagnosis. And at that time, once we knew that his prognosis was terminal, the providers kind of left us at the bedside, and it was the nurses who came and created a web of incredible love and support. And I have since made it my life's work to ensure that nurses understand the value of our work and that our work is something that's sustainable for an entire career. I am currently a full-time assistant professor at the Loretta Heights School of Nursing at Regis University here in Denver, Colorado. And my scholarship and advocacy, again, is focused on improving the well-being of nursing, humanizing healthcare, and ensuring that nursing is something that where we can all flourish and maintain our careers throughout our lives. And this scholarship is a way that I am able to afford to take care of my young family and to really dive in and pursue this work. I am so grateful and honored to be here with all of you and the amazing work you're doing. I keep thinking we all need to collaborate, but I am grateful to be here, and I'm gonna stop now because my daughter's done. Thank you all.
Next, we have a video by Sora Gordon.
Hi, everyone. My name is Sarah Gordon, and I'm so honored and so thankful to be the recipient of the Francine Bono Neri Scholarship. I'm currently pursuing my master's in nursing at the Hunter Bellevue School of Nursing in the hopes of becoming a psychiatric nurse practitioner. I've devoted the majority of my career to mental health, and for the past 5 years, I've specialized in pediatric behavioral health. In addition to being a full-time student, I also currently work full-time in the pediatric inpatient psych unit at my local community hospital, where I care for children facing all sorts of trauma, abuse, and systemic inequities. I grew up in a community where mental health was rarely discussed, but with the aid of Dr. Bono Neri's generous scholarship, I hope to pursue a career where I can advocate for the children in my care in the way that I wish I could have benefited from as a child. And so I'm so grateful for Dr. Bono Neri and the Nursing Education Fund for their generosity and belief in future nurse leaders. And I hope to honor that legacy by continuing to advocate for children's mental health and mentoring others who share that mission.
Our next scholar is Brianna Jimerson.
Hello, everyone. My name is Brianna Jimerson, and I am truly honored to be one of this year's recipients of the NEF Foundation Award. First and foremost, I want to express my deepest gratitude to the NEF Foundation for recognizing students like me who are committed to advancing the field of nursing and improving healthcare within our communities. This award is more than financial support. It is a symbol of encouragement, faith, belief in the future of our profession. When I wrote my essay, I shared my journey into nurse midwifery and women's health, a path by my desire to advocate for women, support safe and equitable birth experiences, and address disparities in maternal health outcomes. Receiving this award validates that purpose and strengthens my motivation to continue this work with compassion and excellence. To the donors, board members, and everyone involved with the NEF Foundation, thank you for investing in my dream and my dreams of so many others. Your generosity doesn't just fund education, it fuels the next generation of nurse leaders, midwives, and educators who will make lasting change in healthcare. To my family, mentors, peers, thank you for believing in me. Thank you for your support and for reminding me why this work matters. And thank you to my husband, who is always by my side through it all. This award inspires me to continue serving women and families with dedication, empathy, and heart. From the bottom of my heart, thank you. Thank you, NEF Foundation, for believing in me and empowering me to make a difference.
Our next scholar would be Natalie Casper.
Hi, good evening. My name is Natalie Casper, and I am deeply honored to be the recipient of the M. Louise Fitzpatrick Scholarship from the Nurses Educational Fund. This scholarship holds great significance for me as it honors the legacy of M. Louise Fitzpatrick, a long-serving dean of Villanova University College of Nursing, now named after Dr. Fitzpatrick, the M. Louise Fitzpatrick College of Nursing. Currently, I am pursuing my Doctor of Nursing practice degree at Villanova, and I will graduate this December. My career has centered on pediatrics since I graduated from the University of Delaware, where I earned both my undergraduate degree and my graduate degree, completing a dual pediatric CNS and pediatric NP program. I have practiced as a pediatric nurse practitioner since 2002. Currently, I work in the Nemours school-based health program in the Delaware Valley, where I work as a pediatric nurse practitioner, providing physical health services, behavioral consultation, medication management, as well as addressing health-related social needs. I am grateful to work directly with children and families, many of whom face significant barriers to healthcare. My goal is to bridge these gaps, especially for students with chronic health conditions who might otherwise be overlooked in a busy school environment. My DNP scholarly project focused on improving asthma care of children in the school setting. Specifically, I implemented asthma education for elementary school teachers and staff to help identify children needing further evaluation and treatment and facilitate access to care. This scholarship not only supports my academic journey, but it also fuels my passion to ensure that every child, regardless of their background, has the access to care they need to grow up to be healthy adults. I sincerely thank the Board of Nurses Educational Fund, as well as Dr. Deborah Shear, who's with me tonight, the program director of Villanova's DNP program, for all the support and encouragement during my DNP journey, and I congratulate all the other scholars. Thank you.
Thank you, Natalie. Our next scholar is Laura Koch.
Hi, everyone. My name is Laura Koch. I am honored to be receiving the 2025 Susan Bauer Ferris Scholarship for Magnet Nursing Leaders. I am pursuing my doctorate of nursing practice in executive leadership at IU School of Nursing in Indianapolis, Indiana. I'm hopefully going to graduate in May of 27. I am a passionate, innovative, and transformational leader with over 20 years of nursing experience. I hope to continue to pursue leadership positions that will allow me to inspire nurses and other allied health team members through innovation, trust, autonomy, reward and recognition, and most of all, empowerment. Just like a true Magnet Nurse leader. I've had the honor of supporting Riley Children's Health achieve their 4th and 5th designation. My goals also extend beyond clinical settings as I aim to drive positive changes in policy, legislative changes, and healthcare organizations by impacting nurses' knowledge and competency in health policy, which is what I aim to use to focus my doctorate project on. Receiving this scholarship means more than I can put into words. It signifies a profound acknowledgement of my dedication and commitment and passion for nursing excellence. Thank you, Dr. Bauer Ferris and NEF for supporting and empowering future nurse leaders like myself to make a meaningful impact in healthcare. Thank you.
Thank you very much, Laura. Our next scholar is Jennifer Quapic.
My name is Jennifer Klopik. I'm deeply honored and extremely grateful to receive the Rita Rice Wazorek Scholarship for Maternal, Infant, and Pediatric Nursing. I am a second career registered nurse with bachelor's degrees in psychology from Rutgers University and nursing from George Mason University. My areas of experience include labor and delivery, obstetric emergency, and psychiatric care. For several years, I have been privileged to care for patients in some of the most meaningful and challenging parts of their lives. I endeavor to enhance positive outcomes for patients in the area of perinatal mental health, considering the interconnected and interdependent relationships between mental, behavioral, and physical health, and recognition for the influence of social determinants of health in care delivery. I truly believe that quality care for mothers also extends to the maternal-infant dyad, children, and the family as a whole. Currently, I am in my final year as a student at Wilkes University pursuing a Master of Science in Nursing in the Psychiatric Mental Health Nurse Practitioner program. Throughout the program, I have studied focusing on clinical advanced practice nursing care and the intersections of perinatal care, trauma, and mental health. My ultimate goal is to become a psychiatric nurse practitioner, providing safe and effective care in areas including perinatal mental health, trauma, and internalizing disorders, to contribute to the well-being of mothers, women, parents, children, and families, and to improve patient outcomes, achieve clinical goals, and enhance quality of life. I am deeply grateful to the NEF board members and affiliates and Rita Rice Wazorek for their generous contributions to my education and supporting me in achieving this goal, as well as lifelong learning, while also caring for patients, my own family, and well, my own children and my family. I also would like to congratulate all of you other scholars here. Your words are amazing, and I wish you all the best. Thank you so much.
Thank you very much, Jennifer. Our next scholar has also sent a video. Her name is Irene Lee.
Hi everyone, my name is Irene Lee and I am a proud recipient of the 2025 Isabel McIsaac Scholarship from NEF. I am currently a family nurse practitioner student at the University of Pennsylvania, which is where I'm filming this. And my goal is to become a bilingual healthcare provider, as I have seen firsthand how language and cultural barriers can impact patient care. I would like to use this opportunity to share one of my proudest moments in healthcare, which is when I was in college. I volunteered to accompany a Mandarin-speaking mom to the hospital and give birth in an English-speaking hospital for the very first time. After 48 hours of very difficult labor, she gave birth to a beautiful baby girl who actually shares the same birthday as me. So I spent my 21st birthday not at a bar, but in a hospital. To this day, my primary goal is to provide high-quality, evidence-based care to people and help patients feel seen and heard even in their most vulnerable moments. Therefore, this NEF scholarship is not just financial relief for me, but also serves as a powerful affirmation to my commitment to serve the underserved. I think that nurses are uniquely positioned to create meaningful change in our society, and I hope that we will continue to stand with our communities. Thank you to the NEF donors for making this scholarship possible and for investing in my education and professional journey. I am very proud to become part of this legacy, and I will continue to pay it forward throughout my career.
That was great. Our next scholar is Yoon-Jae Lee.
All right, good evening, everyone. My name is Yoon-Jae Lee, and I'm truly honored to be the recipient of the 2025-2026 NEF Isabel Hampton Robb Scholarship. I am currently a PhD student at the University of Pennsylvania School of Nursing. I began my nursing journey at Ewha Women's University in South Korea and completed my Doctor of Nursing Practice degree at Johns Hopkins. With nearly 10 years of clinical experience as an inpatient rehab nurse in both South Korea and the US, I have cared for many patients with complex pain conditions. Managing pain safely while preventing opioid misuse has always been one of the most challenging yet meaningful parts of my practice. This experience inspired my DNP project at Hopkins, where a targeted educational intervention significantly improved patients' pain self-efficacy and satisfaction after orthopedic surgery. Today, as a PhD student, I am expanding this work through research that integrates data science, machine learning, and natural language processing to identify and prevent persistent opioid use after surgery. I am very fortunate to be guided by our wonderful mentors at Penn Nursing and to collaborate with interdisciplinary experts in Penn Medicine. Last but not least, I would like to express my deepest gratitude to the NEF, the selection committee, and all the generous donors who make this award possible. Receiving this distinguished NEF scholarship is not only incredible, but also a kind of encouragement for me as a nurse. I will continue striving to contribute as a nurse scientist, educator, and leader who upholds NEF vision and values. Thank you.
Thank you, Yunjae. Our next scholar has also sent a video, Jacqueline Massaro.
Good evening. My name is Jacqueline Massaro. I am honored to be the 2025 recipient of the Maxine E. Elkin Scholarship. I'm a PhD candidate from Boston College Cannell School of Nursing in Chestnut Hill, Massachusetts. My program of research was born out of my clinical practice. For close to 25 years, I have been working in an acute care adult health setting. Many years have been spent as a bedside intensive care unit nurse, and more recently as a wound ostomy continence clinical nurse specialist. Throughout my career, I've often observed disparate pressure injury outcomes, especially in those persons with darker skin tones. My research focuses on the role of social determinants of health, comorbid illness burden, and skin tone in risk profiling for pressure injury development. Health equity is a critical area of study, and ensuring that nurses have clinical tools and interventions that are effective and inclusive to promote health equity among all is paramount. My career goals are twofold. I hope to be a fundable PhD scientist who contributes to nursing science in the advancement of pressure injury prevention and risk assessment. And additionally, I hope to work in academics, teaching students the next generation of nurses and promoting their understanding of pressure injury prevention that is driven by patient-specific profiles and risk factors. This recognition from the NEF and the legacy of Maxine E. Elkin serves as a powerful encouragement as I continue to grow as a nurse educator, researcher, and leader. I am inspired by NEF's mission to support nurses who are committed to advancing the profession through scholarship and service. I am proud to be part of this distinguished community. Thank you once again for your generosity and your belief in my potential. Congratulations to all the 2025 scholarship recipients.
And now I present our next scholar, Savannah Medina.
I wanted to thank you guys and the board. I was the recipient for the Madeline Nagel Scholarship, and so I don't have a script in front of me, but I am a nurse, registered nurse. I went to Arizona State University here, and I'm currently with Northern Arizona University to do my Psych NP. And my focus and what I would like to do after I graduate school is work with individuals who have a neurodivergent disorder, whether it's autism or ADHD or Asperger's. I also have a passion for individuals who struggle with substance use. I have a personal experience with my son who has autism, so I had to go through that process and learn it very well. And so I believe I can make a difference in this community. There's a huge gap for it, whether there's adults who are struggling and now looking into getting a diagnosis, or a child who's struggling in school. And so that's what I'm actually doing right now. I'm in therapy sessions today at clinicals, but I wouldn't have been able to do this without your guys' help, and I really appreciate it. And I just want to be able to use this to focus on school and give back to the community here. So thank you.
Thank you, Savannah. I'm so glad you were able to join us. Our next scholar has also sent a video, Kristen Moss Daniels.
Hello, my name is Kristen Moss, and I am honored to be the recipient of the American Journal of Nursing Thelma Score Scholarship through Nurses Educational Funds. I am currently completing my Master's of Science in Nursing at Wilmington University with a concentration in leadership and education. By the time of the ceremony, I will be finishing my final course in the program. This scholarship has been incredibly meaningful to me. It allowed me to move directly through my program without delay, making it possible to complete my degree this year rather than postponing my final courses until 2026. That support has not only lifted a financial burden, but has also allowed me to focus fully on my studies and my professional growth. As a clinical nurse educator in ambulatory pediatrics, I am passionate about mentorship, education, and amplifying the voice of nursing. My goal is to continue developing initiatives that strengthen the nursing workforce, advocate for the profession, and advance the quality of care for children and families. I want to sincerely thank Nurses Educational Funds, the Scholarship Committee, and the board for selecting me for this honor. I am deeply grateful for your investment in my education and in the future of nursing. Thank you.
Next, we have another video from scholar Justin O'Leary.
Hi, I'm Justin O'Leary, and I am the recipient of this year's Henry B. Spencer Scholarship. It is a tremendous honor to be recognized through a scholarship that reflects such a profound commitment to leadership in nursing and healthcare. Thank you to the Nurses Educational Fund and everyone on this year's selection committee. As a PhD student in nursing at the Hunter Bellevue School of Nursing, my academic journey has been driven by a passion for advancing equitable health outcomes and empowering the nursing profession through evidence-based leadership. My dissertation will explore the financial hardship members of the LGBTQ+ community face in accessing healthcare, especially those with cancer. This complements work in my professional life, looking at nurses' perceptions of financial toxicity in oncology patients very well, and will help me to create a program of study moving forward after my schooling. It is very helpful to have some of the financial burdens of doctoral study taken off my shoulders by receiving this scholarship, and it affirms the importance of the work I aim to do, both in research and in mentoring the next generation of nurses. Thank you again for your generosity and for championing the future of nursing, and congratulations to all of the scholarship winners this year.
Thank you, Justin. Our next scholar is Kathleen Page.
Hi, everyone. I'm Katie Page. I am honored to receive the Allison Adams Wieczorek Scholarship. I am a nurse and midwife for the past 15 years, and I'm a PhD candidate at the University of Colorado Anschutz College of Nursing. I am a health systems and policy scholar, and I study the implementation of midwifery models of care in U.S. hospitals as a complex healthcare intervention to improve access and quality. I'm currently preparing a mixed method study as my study proposal and hope to defend before the end of the year. I've really enjoyed deepening my research and policy knowledge and skills through my doctoral program. My journey into nursing and midwifery grew actually out of an experience in high school where I did job shadowing at a labor and delivery unit and noticed different interactions in care between physicians and patients. And I recognized an opportunity for improved care delivery, specifically through advocating for person-centered and respectful care. And so that is what took me to midwifery. And I was fortunate to find a program at Vanderbilt University School of Nursing that allowed me to direct entry my bachelor's bridge to the midwifery program. And so I became a midwife 15 years ago and just celebrated my 40th birthday. This work has been really special to me. I have been involved in starting and expanding midwifery programs within hospital systems, developing rural health programs through midwife hospitalist service. I also have done work in my professional association advocating for full practice authority for midwives within our state, as well as increased insurance reimbursement from private insurance and Medicaid, and expanding privileging and medical staff membership within hospitals. Some of those bills just passed last year, so I'm excited to work on the implementation components with health systems in our state. And that's what I hope to be able to do with my PhD, is continue not only to work clinically, but also to continue to advocate professionally and continue to research to identify optimal models of care, but also how we can implement them within hospitals to ensure that the services at the organizational level are delivering on the access and quality goals that we need them to. I'm deeply thankful to NEF, to Allison, for her support of nursing and doctoral education, and also for Dr. Rita Rice Wieczorek for making these funds possible. Their champion work for the betterment of society and advocacy for improving person-centered, culturally relevant care is now intimately connected with my own, and I hope my work continues their legacies. Thank you.
Thank you, Katie. Our next scholar is Perla Sanchez Perez.
My name is Perla Sanchez Perez, and I'm honored to be a recipient of the prestigious Marian Powell Scholarship. My academic journey began with a Bachelor's of Science in Biology from the University of Texas at Dallas, a Bachelor's in Science from the University of Texas at Arlington, and I'm currently pursuing my Doctor of Nursing Practice in Nurse Anesthesia at Arkansas State University. As a first-generation Latina and former DACA recipient, my humble beginnings shaped my understanding of underserved patients. These experiences inspired me to become a nurse and pursue advanced practice. And I chose to become a certified nurse anesthetist to help increase Hispanic representation in a field where only 4% are Latino. I chose Arkansas State Nurse Anesthesia Program because it aligns with my goals of becoming a vigilant CRNA who advances equitable care for diverse communities. Currently, I serve as a student representative for the Arkansas Association of Nurse Anesthetists. I'm a student representative for Arkansas, I'm a foundation advocate for the American Association of Nurse Anesthesiology and a treasurer for my cohort. My current quality improvement project focus is virtual reality technology in nurse anesthesia education. Upon graduation, I plan to practice in underserved communities while also mentoring future CRNAs, advocating for a greater diversity and influencing policy reform in nurse anesthesia. Receiving the Marian Powell Scholarship is not only an honor, but a profound gift. It validates the sacrifices, the perseverance, and dreams that have shaped my journey. I want to sincerely thank the Nurses Education Funds, the donors, and everyone who supports the scholarships. Your generosity is not just an investment in my future, but also the countless patients and communities that I will serve. I am truly thankful and will honor this recognition through my clinical practice, my leadership, and my advocacy. Thank you very much.
Thank you, Perla. Our next scholar is Grace Schneider.
Hi, everyone. My name is Grace Schneider, and I am the honored recipient of the Jane Eleanor Knox Scholarship for unique contribution to nursing and clearly demonstrated leadership potential. My clinical background is in pediatric sexual assault nursing, pediatric intensive care, and clinical instruction. And I'm currently being onboarded as a child abuse nurse practitioner at Children's Wisconsin and the Milwaukee Child Advocacy Center. I also serve as chair of the Wisconsin Nurses Association Anti-Human Trafficking Task Force, where we work to educate nurses in Wisconsin on preventing and caring for survivors of human trafficking in our state. I'm in my 5th and final year of the BSN to DNP track at Marquette University, and I'm in the process of implementing my DNP project, in which I redesigned the way the Children's Wisconsin Emergency Department triages pediatric sexual assault patients and survivors of human trafficking. Receiving the Jane Eleanor Knox Scholarship has allowed me to take some time off between jobs to dedicate several weeks to better understand the flow of patients in the ED, educate hundreds of ED staff on this new workflow, and empower nurses to competently and compassionately care for this population. I believe this project will drastically improve the trauma-informed care that we provide our young sexual assault and human trafficking survivors, and I'm so grateful to the Nurses Educational Fund for both investing in me and affording me the time to really invest in my DNP project to improve care for some of Wisconsin's most vulnerable patients. Thank you to NEF, to all the donors for your profound generosity, and congratulations, everyone.
Thank you, Grace. Our next scholar is Jennifer Speza.
Good evening. My name is Jennifer Speza, and I'm truly honored to be the recipient of the Nursing Educational Fund's Barbara Tate Scholarship. I earned my Bachelor's of Science in Nursing from Linfield University in Oregon in 2003, and for more than 15 years, I've served as a certified wound, ostomy, and continence nurse, working primarily in post-acute and home health settings throughout Oregon. Those experiences have shaped my passion for helping patients heal where they live, and for supporting the nurses who care for them every day. I am now attending Georgetown University, pursuing my Master's of Science in Nursing Family Nurse Practitioner program. My academic focus is on primary care with a clinical emphasis in wound, ostomy, and continence management, as well as dermatologic and skin-related conditions that often overlap with these areas, such as chronic wounds, inflammatory skin disorders, and post-surgical healing challenges. I am deeply committed to improving access to high-quality, evidence-based skin and wound care for patients, whether they're in the hospital, home, or rural communities. Looking ahead, I plan to establish a nurse practitioner consulting practice that provides in-person, telehealth, and e-consult services for wound, ostomy, and dermatologic care, including my goal, is to partner closely with primary care teams and a network of specialty services, including dermatology, vascular surgery, endocrinology, infectious disease, urology, colorectal surgery, oncology, and rehabilitation services to create truly integrated patient-centered care. The Barbara Tate Scholarship means far more than financial support. It is an investment in nursing leadership, collaboration, and innovation. It allows me to dedicate myself fully to advanced clinical training and to continue building care models that strengthen the bridge between specialty practice and community health. To the NEF board, the donors, and to the legacy of Barbara Tate, thank you. Your belief in nurses and in advanced practice education empowers us to transform our dedication into impact. I'm proud to carry this honor forward in my studies, my practice, and my advocacy. Thank you so much.
Thank you, Jennifer. Our next scholar is Savannah Sidam.
Hi, everyone. My name is Savannah. I am a DNP student at Loyola University. I'm on their Family Nurse Practitioner, Emergency Nurse Practitioner track, and I graduate in December of 2026. And I am the recipient of the Mary Insall Joanne V. Pontier Scholarship. So I am extremely inspired by my mother, who is also a nurse, and went into nursing leadership, and I followed right in her footsteps. I began my journey as a nurse in 2019 after graduating with my bachelor's from the University of Wisconsin-Oshkosh. I took a singular forensic nursing class in college, but didn't think much of it until I became a sexual assault nurse in 2020 and a pediatric sexual assault nurse in 2023. I moved from an ER nurse role into a coordinator role as the trauma and sexual assault nursing coordinator for McNeil Hospital, which is part of Loyola Medicine, where I have trained over 15 sexual assault nurse examiners and began our regional sexual assault nursing program from scratch, covering our 3 hospitals, McNeil, Loyola, and Gottlieb. Loyola University has provided me with so many opportunities, and the professors have truly been the most kind and supportive team I could ever have asked for. I truly could not have done it without them. My doctoral project is focused on the use of standardized non-fatal strangulation documentation tools and how to train nurses in using these tools, what the best type of training is for them, and how to integrate this into digital format. This project is just the precursor to my future research, which will be focused on thermographic imaging for strangulation patients to see if that is a useful technique. An additional research project I'm working on is common spiritual distress domains experienced by sexual assault survivors and the integration of spiritual care into that realm. I plan to utilize this scholarship to allow me to continue working throughout my school, but allowing me to take off as much time as I need to continue my work with professional organizations such as the International Association of Forensic Nurses, the Academy of Forensic Nurses, and the Illinois Office of the Attorney General. I also am currently intending to work in policy change, such as bridging financial gaps with hospitals and increasing the availability of hospital-based forensic nursing programs for all victims of violence. I would love to say thank you to my family, my coworkers, Loyola, my faculty mentor, Dr. Lindsay Garfield, and also Geraldine, because she knows that there were some hiccups in my application process. So thank you so much. I appreciate you. I'm so honored to be the recipient of this scholarship and able to continue not just my education, but advancing the field of nursing and specifically forensic nursing through research and scholarship. So thank you all and congratulations to everyone.
Thank you, Savannah. And now I'd like to introduce Scholar Marie Tupou.
Good evening, everyone. My name is Marie Tapu, and I'm deeply honored to be the recipient of the Liesel M. Jimenez Scholarship. I want to express my sincere gratitude to Nurses Educational Funds for this recognition and support. Receiving this scholarship affirms my commitment to advancing my education and using nursing leadership, education, and advocacy to improve community and global health. Originally from Guinea-Conakry in West Africa, I am currently pursuing my Doctor of Nursing practice in the Family Nurse Practitioner program at Columbia University. I'm also working at a federally qualified health center, which focuses on equitable access to care and quality improvement initiatives. My passion for nursing was shaped by witnessing health disparities and limited access to basic and preventative care in my community. Later, as a critical care nurse, I saw firsthand how many acute conditions could have been prevented with timely, accessible primary care. These experiences inspired me to transition from the hospital to primary care, where I can focus on prevention, early intervention, and building long-term trusting relationships with my patients. Upon graduation, I plan to continue serving the diverse and underserved populations at my current federally qualified health center and contribute to nursing education through teaching and mentorship. Ultimately, I do hope to expand my impact globally, leading public health initiatives that address the root causes of preventable illness and promote sustainable community-centered healthcare. This scholarship not only eases my financial burden, but also motivates me to carry forward the legacy of Ms. Liesel M. Jimenez, whose dedication to public health and service continues to inspire me and many around her. I am truly grateful for this opportunity and remain committed to upholding the values of passion, knowledge, and integrity that this award represents. Thank you again for believing in me and investing in my journey.
Thank you, Marie. Next scholar is Catherine Valentine.
Hi, my name's Katie. Catherine, but I go by Katie Valentine.
Katie.
And I'm honored to have received the Margaret Gold Tyson Scholarship. I currently attend the University of Northern Colorado, and I just began my third year of my PhD nursing education program. My research focus is nurses and nursing students with disabilities, because I personally am a nurse with a disability. And so I have that experience of going through nursing school and being a professional with a disability. And I feel really strongly that disabled people belong in nursing and that we need to work harder to both admit disabled students and to graduate them. So that's the focus of my dissertation work. I currently work as assistant nursing faculty and the skills lab coordinator at California Baptist University, and that's in Riverside. And I'm just really grateful for this scholarship. It's giving me the funding to focus on my education, focus on my research goals. So I just want to express my appreciation to the NEF for providing me that financial freedom as I continue to pursue my PhD. Thank you so much.
Thank you, Katie. Our next scholar sent a video. Her name is Erin Wallace.
Hi there, my name is Erin Wallace, and I'm truly honored to be the recipient of the Laura D. Smith National Student Nurse Association Scholarship for the 2025-2026 year. I earned my bachelor's from San Diego State University, and I'm currently pursuing my master's at Frontier Nursing University, and I'm going to specialize in psychiatric mental health nurse practitioner. I'm currently in my 7th of 8th terms, and I look forward to graduating in March 2026. My academic and clinical focus is on advancing mental health care for veterans and underserved populations. This passion comes from my 15 years of experience in the emergency department working with veterans, as well as a personal experience where we lost a close family friend who was a veteran that did not get the care that he needed. These experiences have inspired me to explore innovative approaches to treatment such as equine assisted therapy and to integrate them in evidence-based psychiatric care. My long-term goal is to develop trauma-informed programs that combine both traditional and complementary therapies, helping people who haven't found the care that they need. Receiving this scholarship from NEF is both an honor and a tremendous support. As a primary caregiver for my mom, this award eases financial stress and allows me to focus more fully on my education, research, and future contributions to the field of mental health. I'm deeply grateful for this investment in my vision and for the opportunity to carry out what I need to do to help veterans and vulnerable populations. And once again, thank you so much for your support.
Thank you to Erin. Our next scholar had a test this afternoon and wasn't certain if she would be able to make tonight's event. Maxine Amana Frimpong.
Hello everyone, my name is Maxine Amina Frimpong and I'm deeply honored to be the recipient of the Estelle Massey Osborne Scholarship for 2025. I am currently a master's student at New York University, Roy Myers College of Nursing in the Family Nurse Practitioner specialization. My clinical focus is primarily on community and global health and primary care with a special interest in health equity and access to care for underserved and marginalized communities. I'm very passionate about ensuring that language, culture, or background are never barriers to receiving quality health care. So my career goal is to become a family nurse practitioner and a nurse leader leading community-based primary care programs that emphasize on prevention, education, and empowerment. I also hope to serve as an educator and advocate, helping shape future nurses and advancing policies that promote equitable care. Receiving the Estelle Massey Osborne Scholarship is an incredible honor and a true source of encouragement for me. It inspires me to keep giving my best and reminds me why I chose this path, to serve, to lead, and to make a difference. A huge thank you again to NEF for believing in me and investing in my journey. Thank you so much.
As usual, I'm inspired by all the amazing work that the scholars are doing, and I just want to applaud you all. So that completes the presentations. Every NEF scholar becomes a member of the Circle of Scholars. I actually had my son, who was working sort of at the Flatiron Building, do a little video of me. So it was very professional because of that. I'm just talking about my experience as a scholar, and I invite you all to kind of introduce yourselves to the other Circle of Scholars through a video or at least stay connected in some way. There's been increased activity in the Circle of Scholars this year. They were contacted about their interest in becoming an active NEF member, and we now have a new scholar liaison on the NEF Board of Directors, and another scholar liaison on the new NEF Communications Committee. And more activities for scholars are ahead. So I hope you will remain connected to each other, to NEF, and we have so much to offer each other and work together. So now, thank you again for letting me be the MC of this program. It's always my pleasure and an honor. And now I'll turn the program back to Joan Marin.
Thank you, Nancy. So we've completed once again a wonderful celebration of our NEF scholars. And I was struck in listening to the stories and the comments by each of the scholars at how many of you commented that and emphasized that it was not just the funding of the scholarship that was really meaningful to you, but the fact that it was an affirmation of your commitment to nursing, your passion for nursing. And what struck me about that is that we are an organization that believes in the future of nursing. And we believe that the future of nursing is dependent upon the leadership and excellence that all of you bring to it. And because of that, we are an organization that puts our money where our belief is. And I think the evidence of the benefit of that is all of you in this group of scholars tonight, the scholars who have come before you and the scholars who will come after you. So I really appreciate and on behalf of the board, we appreciate all that you have done and will do, and we are really thrilled to provide this support to you as you move forward in your professional pursuits. So thank you all for attending this evening. Thank you to all the friends, the deans, directors, and all of our board and advisory committee and emeritus members. Thank you again, and have a good night. Rest of it anyway.
Bravo.
Good night.
Good night.
Thanks so much, everybody.
Thank you. Thank you.
Thank you, everyone. Thank you.